University, Saudi Arabia, talking about clinical dementia. Can an objective cure be found in spirituality?
Hi, thank you. Thank you so
Hi.
much.
How are you?
Hi, can you hear me?
Yes.
Okay, perfect. So I'll share the slide, or the slide will come from you.
You can share
Okay,
it if you want. Yes.
Okay, let me just share my screen and okay, for a while, please. Okay, can you see my slides?
Yes.
Okay, so thank you so much for the great introduction. So let me just introduce myself. So I am Charmaine Co-Enarsico, and I am a simulation educator here in Simulation and Skills Development Center in Princess Noor bint Abdurrahman University here in Riyadh, Kingdom of Saudi Arabia. So I will be talking about clinical dementia. Can an objective cure be found in spirituality? So thank you so much for the previous speaker who had at least introduced my topic for today. So our presentation objectives will be, we will gain an overview and analysis of the preventive effects of spiritual exercise on dementia. And also, we will discuss how spiritual exercises delay dementia. And the last will be discuss the art of living ways targeted at reducing the incidence and prevalence of dementia. So what is dementia? So as we had discussed a while back with the previous speaker, so dementia is unacquired. So for example, our Alzheimer's disease is a degenerative disease causing the loss of cognition, lurking and waiting to be triggered out of every human being, men and women alike. So this illness is significantly burdensome, affecting social and occupational function, placing physical, emotional, and financial toll, not only the patient suffering from the disease, but also on their families and the society as a whole. So people suffering from dementia, even forget how to live. So, and also in terms of losing their capacity to accomplish their daily chores. So dementia is also popularly linked with more than one neuropathology, and the diagnosis of the disease warrants special attention and is a field open to deeper exploration of the mind. So several other authors have weighed in on the concept of spirituality and provided, let me move on. Let me go back to the slide. Amen. Okay, so that's dementia, and so sometimes almost all of the time there are fear from this dreaded brain disorder that creeps among people like cancer, as one of the recent survey has stated. So this fear handicap shift how one perceives and interprets our shared world. So there is a significant social dilemma connected to the diminished aspects of thinking that hallmark this disease in terms of limited self-assessment, hampered memory-based skills, and incapacity to communicate effectively in social settings. So dementia retards the very aspect of being human and mandates research and reflection on the spiritual aspect of dementia and its cure. So what is spirituality? So spirituality, several other authors have weighed in on the concept of spirituality and provided different definitions. And this is a subjective belief system that incorporates self-awareness and reference to a transcendence dimension and the unique window into attachment process on adulthood. So can I ask hello, can you hear me?
Yes.
Yes, can I ask you to please share my presentation that I sent?
Yeah.
Sorry.
Yeah. Yeah. Sure.
Yeah, because yeah.
Sure.
Thank you. I'm sorry.
Yeah. You stop your share.
Yes, please. Yes.
Yeah. Thank you.
Okay.
1 minute.
So yeah, let's move on to the dementia slide.
Okay.
Yes. Okay. So let's go on to the umbrella. Okay. Okay, thank you so much. So as we were, let me go back to dementia. So dementia has many different types, and it is pictured as an umbrella. So the most common type of dementia is Alzheimer's disease, and it is illustrated as the handle of the umbrella. So it has 60 to 80% of the cases. So, and then the other lesser common types of dementia, like vascular and Lewy body or frontotemporal dementia, is illustrated as a separate section of the umbrella. So let us move on to the next slide, please. Okay, so dementia has been called the theological disease. So here, dementia entails a loss of self and is disintegrative and non-redemptive. Thus, this is challenging theologically. So the concept of dementia as a theological disease is from David Keck, wherein he has a book entitled Forgetting Whose We Are. So Alzheimer's disease and the love of God. So this is from Nashville, Abingdon. So he cared for his mother with Alzheimer's disease. And he said that the loss of memory entails a loss of self and the apparent disintegration of a human being. So perhaps Alzheimer's patients can remain as that death and loss of control belong at the heart of spiritual reflection. Now, this statement, but can you truly say my mind is absent and body an empty shell? So this concept actually was like presented and was presented by Christine Bryden in when she spoke in National Alzheimer's Conference in 2001, and she has a book, and she's a Christian who suffered frontotemporal dementia, and she spoke in that National Alzheimer's Conference. So her book entitled Who Will I Be When I Die? So she said that the statement, my body is absent and body an empty shell, is a toxic lie of dementia. She said that this medical model silences the voice of people with dementia and denies them their spiritual growth. So let me share a statement from her. So she said that, I believe that I am much more than just my brain structure and function, which is declining daily. My creation in the divine image is a soul capable of love, sacrifice, and hope, not as a perfect human being in mind or body. I want you to relate to me in that way, seeing me as God sees me. I am confident that even if the continuing damage to my temporal lobe might diminish the intensity of my God experience, there will be other ways in which I can maintain my relationship with God. So it means that in the end of life of a person, and if you are, for example, diagnosed with this disease, then truly it is a theological disease, because you would have to look at the real meaning of life in this stage. Let me move on. So the next slide, please. So spirituality. So in spirituality, several authors have, weighed it. And the ultimate meaning of spirituality actually is not only religion. Wherein religion gives us, for example, a way or a tool on how are we going to relate with this supreme being. So spirituality can also be our relationship with others, our intimacy with others, and of our God. Spirituality can also our relationship with nature, the sea, the mountains, the gardens. Spirituality can also be reflected, or we can express it through the music, through art, through poetry, and through dance. So the next slide, please. So spirituality, as I have said a while back, is not necessary to be linked with a particular religion, as it seems to be a psychological construct. Let's move to the next slide, please. So dementia versus spirituality. So religion, spirituality, and or belief should be viewed as a type of positive support that helps older adults to live fruitful lives despite the many challenges of aging. So let's move on. Next slide, please. So the cognitive components of dementia and spirituality. The past slide, please. Okay, so Dr. David Evans, PhD and senior researcher of the University of Alabama, UK, states that engaging adults with Alzheimer's disease in activities can prevent disease-related agitation. So many spiritual and religious activities, if properly selected, can be used to engage adults with dementia. So this approach is called procedural and emotional religious activity therapy. So can be used by various religious traditions and extended to multiple therapeutic venues. So let's move on to the next. So an overview of the preventive effects of spiritual exercise on dementia. Our brains are truly amazing. They show unexpected recovery after severe trauma and damage that seems almost magical. So although it certainly seems inexplicable, scientists have been hard at work studying exactly these cases over the last several decades and have found the explanation behind the magic. So this magic actually is neuroplasticity. So neuroplasticity is the physiological changes in the brain that happen as a result of our interactions with our environment. So the connections among the cells in our brains reorganize in response to our changing needs. So this dynamic process allows us to learn from and adapt to different experiences. So it's neuroplasticity. So let's move on to the next, please. Next slide, please. So here we can see in how does neuroplasticity work. So if there is, let's go back to the previous slide. Can you hear me?
Yeah, sure.
Okay, here we can see that there is a synaptic activation. So if there is a weak activation of that nerve cell, so it does not warrant any change in the synapse or the connections. But if we have strong and frequent activation, then there would be a change in synaptic structure. So then, if we do frequent activation of this cells, so there would be a change in synaptic structure, and it strengthens connection. So its implication is that we have to reinforce ongoing reinforcement of activities. So we must use any method or technology to keep activating this synapse. So let's move on to the next slide, please. Okay, so the father of neuroscience, Santiago Ramon y Cajal, talked about neuronal plasticity in the early 1900s. So he recognized that brains could indeed change even after a person had reached adulthood. So in the 1960s, it was discovered that neurons could reorganize after a traumatic event. So further research found that stress can change not only the functions, but also the structure of the brain itself. So the brain is a renewable organ as proven by neuroplasticity. So let's move to the next slide, please. Okay, so here, neuroplasticity is one fundamental process that describes any change in final neural activity or behavioral response. So there are two main types of neuroplasticity. So we have structural neuroplasticity and functional neuroplasticity. So structural neuroplasticity is the strength of the connections between neurons or synapses. These are the changes that is made in between neurons. While functional neuroplasticity, these are the permanent changes in synapses due to learning. So here in the picture, we can see that in the change in the structure, so the brain becomes, there is an activation and functional change in the brain. So let's move on, please, to the next. So neuroplasticity as a biological tool to relearn the forgotten, so in cases of dementia. So promoting spirituality and meditation exercises in patients of dementia actually stimulates the brain's near magical activities to regenerate functionally from new pathways that enhances learning skills. So each new lesson has the potential to connect and reorganize new neurons and change our brain's default mode of operation. So this in turn leads to significant functional improvement of the demented, provided that the task is repeated regularly. So let's move on, please. So here, once innate skills, talents, and abilities can be developed and or improved with a growth mindset. So if we are open and if we do it regularly and repetitively, there is really a growth, and it is also called as the spirituality-induced neuroplasticity of the brain. So let's move on, please. So the benefits of neuroplastic induction in adults with dementia. So it can restore old lost connections and functions that have not been used in some time. So this also enhances the memory and even enhance overall cognitive skills. So with sustained effort and a healthy lifestyle, older adults are just as able to promote positive change and growth in their brains. Let's move on. So here we can see spiritually enriched environments are also critical for promoting neuroplasticity. So they can provoke growth and positive adoption long after the critical learning period of early childhood and young adulthood is over. So we are to provide an environment for spiritual growth for our demented patients. So summarizing the benefits of neuroplasticity on the demented brain. So the brain has the ability to rewire functions. And for example, if an area that controls one sense is damaged, other areas may be able to pick up the slack. So losing function in one area may enhance functions in the other areas. So if one sense is lost, the others may become heightened. So this fashion of neuronal remodeling eventually leads to enhanced memory abilities, wide range of enhanced cognitive abilities, and more effective learning. So let's move on to the next slide. So spiritual exercises to delay dementia. So we can provide exercises to our demented patients, for example, chanting hymns, reading religious texts, memorizing devotional songs, performing specific worship patterns. So day-to-day behaviors can have measurable effects on brain structure and function, which can offer healing and recovery from psychiatric disorders. So there are two key underlying elements. So we have to do task repetition and task-specific practice. Next slide, please. So here we can see that in the pathway, so neural pathways connect relatively in distant areas of the brain or nervous system. So each pathway is associated with a particular action or behavior. So here in the line that is very blue, that is very strong, this is a very strong pathway. So every time we think, feel, or do something, we strengthen these pathways. So habits are well-traveled pathways. So our brain finds these things easy to do. Now here in neuroplasticity, we can see here in the first one, So if there are new thoughts and skills, they carve out new pathways. For example, if we are using GPS and then we go to other ways, so it opens a new pathways for our brain. Now, what happens is that in repetition and practice, so it strengthens these pathways, forming new habits. So what happens in the old pathways, if we do not use them, so they they get lessened and they get weakened. So with repeated and direct attention towards desired change, so all we have to do is we rewire our way of thinking. Okay, so next slide, please. So researchers at the American Academy of Neurology observed a slower rate of mental decline in Alzheimer's patients with higher levels of religion and spirituality. So the art of living ways targeted at reducing the incidence and prevalence of dementia. So according to the research done by David E. Vance in 2004, so we have to engage adults with Alzheimer's disease in activities that can prevent disease agitation. So we find they find meaningful and enjoyable activities. It has been proven to be a difficult task due to severe damage to explicit memory and executive functioning. So fortunately, many spiritual and religious activities, if properly selected, can be used to engage adults with dementia. So this, actually, I had presented it a while back. So this is called as a procedural and emotional religious activity therapy. So this can be used by various religious traditions and extended to multiple therapeutic venues. So according to Jessica Cassidy, so with meditation, your brain is effectively being rewired as your feelings and thoughts morph toward a more pleasant outlook. Your brain is also transforming, making this way of thought more of a default. The more your brain changes from meditation, the more you react to everyday life with that same sense of calm, compassion, and awareness. So the more mindful we become and the more we meditate, as for example with our demented patients, the more their brains adapt to this state as a default state. So this is why mindfulness meditation has such a big impact on regular practitioners, even outside of their dedicated practice time. And they have taught their brain to be mindful, calm, at peace, and centered all throughout the day, not just when they are actively meditating. So here also, musical training, for example, hymns or devotional songs. So several forms of intensive training have an impact on brain and cognition, but it is possible that musical training has specific effects that other forms of training do not have, or even produces a range of different effects. So the cognitive enhancement effects of musical training, the result of neuroplastic processes, might be due to a combination of skills required by music study, such as, for example, decoding visual information into motor activity. So when they see lines and then they sing it out. So memorizing extended passages of music, learning music structures and rules, learning to make fine auditory, spectral, and temporal discriminations, and learning to perform skilled bimanual finger movements when they play instruments, for example. So our key take-home message is that, according to Elizabeth Thornton, because of the power of neuroplasticity, you can in fact reframe your world and rewire your brain so that you are more objective. So you have the power to see things as they are, so that you can respond thoughtfully, deliberately, and effectively to everything you experience. So here, hence, we can confidently assume that meditation induced physiological and morphological changes in neurons will lead to more extensive and better functioning synaptic connections that will improve cognition, memory, and psychomotor skills of victims of dementia who have forgotten the daily nuances of living. So meditation invokes that which is known in neuroscience as neuroplasticity, which is the loosening of the old nerve cells or hardwiring in the brain to make space for the new to emerge. So let's move on. Hence, we can conclude that spirituality in any form, may it be religion or meditation, truly aligns in an evidence-based manner with the concept of mind-body medicine, wherein the mind has the power to rewire neuronal pathways and redesign new ones that will be re-encoded into our inherent blueprint and enable us to overcome the damage and recreate novel function areas to compensate for which was lost. So hence, a demented patient can very possibly be upgraded from a subhuman to a near human status. So brains are really tricky. Our brains are really tricky and adaptable organs. So for all the neuroplasticity, allowing our brains to reconfigure themselves to the biases of our computers, we are just as neuroplastic in our ability to eventually recover and adapt. So the human brain is akin to a computer in many ways. One of them is the shared ability to learn new information at any stage. In dementia, while previous learned behaviors are forgotten, like files deleted from a computerized system, however, a computer that lost its files still has the ability to incorporate new files into its system. Similarly, the human brain, if simulated effectively, can recover and regain its capacity for lost cognitive function. So spirituality actually is a strong ray of hope in presenting itself as a practicable tool for this specific stimulus that is needed by a damaged brain that will promote neurosensory pathways and facilitate regaining of the practices of everyday life. So our minds have the incredible capacity to both alter the strength of connections among neurons, essentially rewiring them and create entirely new pathways. So it is better than a computer, which cannot create new hardware when its system crashes and seem fixed and helpless. So spiritual practice as a therapeutic tool in prevention or intervention of dementia and related conditions holds a promise that is too strong to be ignored. So current research is still in its juvenile stage, but forensic psychologists and cognitive behavior therapists have discovered significantly positive results among their patients. This welcomes a field for further exploration on the outcomes of spirituality and meditation-oriented lifestyle changes among the senile and the demented. So last but not the least, if we are the sculptor of our own brain. So how cool is that? So changing our habits of mind can also change our lives. So this is some of my useful references, which you can look at. Thank you so much. And the last slide is the references that I had. Thank you so much for your time.
Thank you, Dr. Charmaine, for your presentation. If there's